Hey everybody, I'm back for a second time. That was a little failed attempt. I'm having connection issues. This topic is really important. It's Polycystic Ovarian Syndrome. And what we're focusing on is that we know that it affects 1 in 10 women. We know that it has genetic and hereditary components, and that you can get it from your father's side of the family or your mother's side of the family. We are talking with Dr. Raquel Hammonds, who's Dr. Raquel is one of my absolute favorites to talk to on these episodes on Tuesdays, which are called Fertility Tip Tuesday. So sometimes we share these episodes in YouTube, on Facebook, and now we're moving to recording them live. You know, we do a lot of topics on a lot of different things. So if you haven't checked our YouTube channel out yet, there she is, the fabulous, the beautiful Dr. Raquel. So good to see you.
Nice to see you.
Look, I'm so excited for this particular, venue for us because we have such a great chance to interact and we get tons of great questions. So no matter what we're talking about, we want you, our audience, our community to ask us questions. We really are going to talk about how PCOS runs in the family and when you might have overlooked your own symptoms, so that if you do have children, when to, take them to the doctor, when to start having this conversation with them. So Raquel is the first naturopathic MD that's integrated into the specialty fertility system. First one in the whole entire world. Let's just let that land for a second. It is so amazing. And nothing goes unspoken about when we do these topics together. She practices under the Fertility Advantage. So it's so good to see everybody. If you haven't followed her yet, the Fertility Advantage is fantastic. Just quick background on Raquel and myself. Most of you might have seen me earlier with Dr. Serena Chen talking about my own fertility preservation journey. I landed in reproductive medicine by way of a cancer diagnosis. I do have an almost 7-year-old success story from fertility preservation. I now run the Fertility Answers app community and platform. Folks like Dr. Raquel answer questions for free on both the iOS and Android app. So we are excited to have this conversation. And I think for starters, Raquel, there is data indicating that girls who have mothers with PCOS are 8 times more likely to have it than the general population.
Yes. And that's such a good question because I feel like so often we feel like it's something that you gradually get or something that can only be like exposed to you from your environment. But most recent research has shown that girls and boys actually can have PCOS and then also symptoms of like metabolic syndrome. Okay,
which is really interesting because we certainly have always thought of it as a girl's issue. Right. Mm-hmm. Because we attribute it so much with periods, irregular periods and infertility. How would it manifest itself in a boy, versus a female? Because I always feel like it normalizes our experience as a woman to know, hey, this happens to guys too.
Yeah. And the way that it manifests itself is that in women and in men, what happens is that if you have like high blood pressure or high cholesterol or heart disease, your baby or your fetus's body cannot metabolically create the hormones and the things that it needs to have that stability. So what happens is your child over time also develops these same symptoms. And so it's PCOS and metabolic syndrome look a lot alike because metabolic syndrome has high blood pressure, body fat around the waist, and then high cholesterol and triglycerides. So you can see how in a boy that could also be very similar to how it would present in women because these women also have like high abdominal adiposity, they have like facial hair, high triglycerides. So the symptoms look a lot alike in both men and women.
Okay, that's super interesting. Now, we do say, though, genetics isn't a life sentence. I mean, we say that in our company because we do have a fertility wellness DNA kit that looks at genetic markers for PCOS and all those things that go along with it that you were just talking about. But if genetics is not a life sentence and biology isn't a life sentence, what lifestyle changes can people make that could have a positive impact on their reproductive outcomes?
Yeah. And so it's really cool because, sorry about that. It's really cool because in med school, I took a class called nutrigenomics and it nutrigenomics, and it talks about how even though you have these genes, like you said, it's not a life sentence, things that take place in your environment could play a huge part in diseases that you get. And so when it comes to PCOS, the first line treatment, it's not just in naturopathic medicine, but in allopathic medicine, medicine as well. The first line treatment is exercise and diet. So to me, that speaks to how you really can heal this disease from the root if you kind of modify the things in your environment that are causing like the symptoms to be exacerbated.
Okay. And I that's everything that you're about. So when we say naturopathic MD and people are like, well, what does that really mean? And how does that impact, reproductive medicine? And everything that you're about is like about the environment and gut health and all those things.
Yeah.
Right. So environment has so much to do about it, and nutrigenomics certainly. But what about even, like you were talking about metabolic syndrome, people who are already insulin resistant. So how could they make small changes in their diet to maybe reduce the insulin resistance, maybe as an attempt prior to going on something like metformin or alongside going on metformin?
Yeah, so insulin resistance is the number one thing you want to treat when you are trying to improve your fertility, because insulin resistance affects ovulation, which we know is needed for your body to conceive. So what I always do is I focus on giving your body foods to help that insulin not spike. So oftentimes we eat, like, let's say a burger. What happens is you cause that insulin to spike. And after you do that a couple of times, now your body is not responding as it should to kind of bring that blood sugar back down. So I always say, first and foremost, incorporating more fiber into your diet in the forms of like green leafy vegetables, broccoli, kale, having high fiber foods like that. And then proteins like chicken, salmon, things like that.
I love how much you advocate for salmon, because I could eat salmon every day pretty much. I love salmon and getting those omega-3s in, which are great. Now, let's take it a step further and say, okay, we help everyone conceive, and what should we look at when it comes to our children? So if PCOS, runs in my family, and now I just had a daughter or a son, what are some of those even early lifestyle factors after the baby is born that I need to be mindful of to help reduce the risk?
Right. Great question. And so with kids, they kind of do what they see. I know, like in those early years, a lot of kids are very picky. They only want certain things. But just like how a mom's body when she is pregnant is influencing like their taste buds and things that they want, when a kid is growing up, if they see you constantly consuming like fruit and vegetables and water, they'll follow that same pattern. I think it's so cute because my nieces and nephews love water. They love fruit. And it's because my sister does that. And so to me, some of the easiest ways to kind of influence your child's palate is to put out like a plethora of fruits. Instead of like having candy, put out like all these colorful, beautiful fruits, because it's going to help the kids, want to have that instead of, consuming those sugars that could be influencing like PCOS and metabolic syndrome.
Exactly. V Kitty, don't leave yet. We're getting to the questions. Hang on. Hang tight. We have an agenda, but we're getting to the questions. So I'm going back up right now. I was first saying hi to everybody, and we're going to get to all the questions. There are a few that are definitely coming up. So, V Kitty, perfect example. She hasn't gotten a period in 5 months. Is that PCOS? Is that not PCOS? Could it be something else? Really, what kind of diagnostics do we want to encourage her to ask her provider for?
So in that case, I always recommend going to your OBGYN or your fertility doctor and recommending a transvaginal ultrasound. Oftentimes it could be a cyst that is developing and not allowing you to have a period. That was very common before when I worked in a fertility center. Another good thing is a lot of women take medicines like medroxyprogesterone, and it stops your period. For some women, their periods never come back. So for you, I would kind of do like a look back into my medical history and see what was I doing around the time that my period stopped. That's a very good way to kind of think about. Mm-hmm.
That's a great look. And then, could weight gain or weight loss also impact that? Is that something you would look at around that time period? Did diet change? Exactly. I mean, 5 months ago, the whole world was in a high state of stress. I mean, I think we're still in a high state of stress, but you've talked a lot about the impact of stress and those cortisol levels even on periods. So how can cortisol, if cortisol is super high over time, Dr. Raquel, can we lose our period because of that?
So cortisol alone won't cause us to lose our period, but cortisol is one of those stress hormones that puts our body in this fight or flight state. And when your body is in a state of fight or flight, it's telling your body, this is not the time to get pregnant, have a baby, have a normal cycle. When you're stressed, your body is not thinking about your fertility. It's thinking about keeping you alive, because I know we talked before, when you're stressed out, your body can't tell if you made an F on your test or if a bear is chasing you. Your body can't tell. It responds in the same way. It's just like, You know, it's the same stressor. And so in those moments, a lot of times it's annoying because your doctor always says like, oh, you need to stop stressing.
Just give it time. Or I hate that line. Stop stressing and just relax. I mean, there's nothing more frustrating than that. Okay, so great. Annoying. How do I do that? I mean, the whole world is stressed.
Yeah. And stress really does do that. It really does send our body into a state of fight or flight, and it shuts down everything. Yeah. So stress is definitely a predictor of missed cycles. If you have some of those associated symptoms of PCOS, like hair on your face or insulin resistance or high visceral fat, like around your abdomen, look for some of those other symptoms. But I would definitely recommend before self-diagnosing yourself to go in and see a doctor and do a transvaginal ultrasound and get a workup to just look at your hormones.
Yeah, got it. Okay. And then we also have another user, Harjra. I hope I said your beautiful name correctly. She's been getting her cycle every 3 weeks. It became quite irregular, and it's only lasting 4 days instead of her usual 6, 7. Okay. And she's also had some light spotting.
Okay. Yeah. So in that case, again, what I would see most often is that Dr. Google is the worst. And it kind of tells us it tells us like the information that is the worst possible scenario of what's wrong. And most often there's just something that might be off. Some people have like luteal phase dysfunction. Some people have like problems with their estrogen to FSH ratio. All of these things affect your monthly cycle. So I always tell people, first things first, if you're seeing a naturopathic doctor or a traditional doctor, you want to make sure that you're getting the appropriate workup to look at your hormones, to look at your insulin, especially doing that first thing in the morning fasting, if you want a very accurate number, but really getting those ultrasounds because it'll allow the doctor to see if your uterine lining is very, very thick. That's like an indicator that you haven't been having a normal period.
Okay, now to check your insulin resistance, do you have to drink that nasty stuff that I was supposed to drink while I was pregnant? Is that the only way to do the resting, the fasting thing? That was disgusting. No. The sugary syrup. It's like, this can't possibly be good for my fetus.
Exactly. No. So that's like the oral glucose tolerance test. And a lot of like women in pregnancy have to do that. And they hate that test.
Oh, I took one look at it and I was like, I think I have to reschedule. I'm out of here.
I know. I can't do this.
Yeah. This is too much. But there's something, there's another way to check for insulin resistance. It's not that, right?
Yes. Okay. So it's another way. There's another way. Most often, some people go midday if they can't go in the morning because of work or responsibilities. And in that case, there are other like parameters you can look at to look for the numbers like midday. But if you want fasting glucose, most often you can just go in the morning and it's like a plasma glucose, I want to say, and they can just either draw your blood or do a finger prick, and it's a really quick way to get your levels.
Okay. And now when you say full workup, let's actually clarify what that means, because I sometimes feel like folks don't know what to ask for. And I was just sharing with everybody, I was at a primary care doctor recently, had new insurance, needed to get all my new referrals. And I went through my list and I was like, this is what I need. And I had it written down. Yeah. I flipped through the paper and she was like, doctors don't like to get testing done for things we don't know how to interpret. And I was like, well, that's okay. Just tell me where I need to go in order to get the rest of these done. And so she gave me a referral for this, that, and the other thing. And so what is this full workup really mean when we say that when it comes to fertility?
So for fertility, I even like posted about this the other day, but the first thing is looking at your estrogen to FSH ratio. So it's really cool because a lot of women, unfortunately, they get these tests done through an OBGYN and they don't get it done during the right time of the month. So if you want to know about your fertility specifically, then you have to make sure you go to your OBGYN during the first 3 days of your cycle. That's going to give an appropriate measurement. So you want to make sure you're getting that E2, FSH, inhibin B, and AMH. Those are like the baseline for fertility. Right. But I like to go a step further just because to me, fertility is not just that small number of hormones. Right. There's so much more. So I also like to look at your vitamin D. Your progesterone is huge because it's letting us know, is your progesterone adequate enough to carry a baby to term? So also including like your LH, your progesterone, and your thyroid function is huge because your thyroid, if it's hyper or hypoactive, it can cause miscarriage. So I do like to take it a step further with those.
So in that case, because Hajra does have hypothyroidism, so if we take that case in particular, with proper medication, it can reduce the risk of miscarriage, correct?
Oh, absolutely. Absolutely.
But you have to really monitor your levels, right?
You have to monitor your levels. It does have to be prescribed. And a very common misconception that I see, especially in women who want to go a more natural route, is that they like ixnay the thyroid meds altogether. And that's not okay. You have to get your thyroid under control. There are more like natural thyroid supplements you can take, like I can't remember the name of it, but they're not as synthetic as the normal meds that you normally get. Nature is a better one for women who don't want to take the synthetic forms, but you have to make sure your thyroid is under control because it 100% plays a role in miscarriage.
So I am prescribed Nature, and I will say, if I'm not taking it regularly, you know what happens to me? I get thinned. My hair thins a lot up here.
Really?
Oh, yeah. And it's like within a couple weeks, I can tell a difference. And I'm not noticing my hair falling out or anything, but without taking it, that's the first visible symptom. I definitely am fatigued as well. So when I started taking it, I was shocked at my energy levels within the first couple weeks of taking it regularly. So, I mean, I'm not paid to advocate for Nature, but I can definitely tell you my personal experience has been positive taking it. And I have like really thinning hair in the front. I wish I could just transplant this, the thick hair in the back to the front. It would be a little bit easier. Yeah.
Exactly.
So now Fertility Gifts has blocked tubes. So, not PCOS related, but since we're on the line here, I'd love to kind of address that because IVF is definitely, going to be the best possible route for blocked tubes.
Exactly. And I love that you brought this question up, and I love that someone put it in the chat today, because another thing that a lot of women who want to conceive naturally, they bypass the hormone testing and the HSG, but you have to do these things because even if you want to conceive naturally, if your tubes are blocked, you're like shooting in the dark,
right?
It's not going to get through. You have to make sure that you're doing the appropriate thing. So so when it comes to blocked tubes, I know sometimes doctors will recommend like trying to get the tissue removed, but most oftentimes IVF is the best bet.
Okay. And then somebody else has, Maria Jose has a subdermal implant in polycystic ovary syndrome. So is that something that's like a treatment and she's not yet ready to conceive, or is that a birth control? I'm not sure.
Yeah, I'm not sure.
Or is that a treatment, like a slow release hormone or something? All right. So write us below and let us know. Okay.
Yeah, if it's like Nexplanon or something like that, I'm not sure.
Right. Okay. Yeah. I mean, Harshra, don't give up hope. Please don't give up hope. I mean, I understand that it feels complicated. I had, 5 chemical pregnancies. I am lucky that I had fertility preservation when I was 31. So I was able to use those and do a frozen embryo transfer. But, like I mentioned, I'm on Nature, and I kind of always wondered for a while if that was to blame for the recurrent chemical pregnancies, those very early miscarriages that I was having. I kind of had wondered, but then I was already on the Nature and ended up with a spontaneous pregnancy that was a very much like I can't believe I'm even pregnant. I didn't think it was possible kind of a thing. And I still lost that one. So whether it's my egg quality post chemo or my age or whatever else it might be, it just wasn't meant for me to do it the old fashioned way and have sex and get pregnant. And I get the pain of that completely. I get the struggle. I get it all. I'm gearing up to do another frozen embryo transfer this fall. And it's the only way for me to be a parent, so we're here for that. All right. So hopefully, let's see. Brown Eyes has been trying to conceive for 2 years. Have you gotten in for an IVF consult or consult with a Dr. Raquel? We see this so often on the app. So often on the app where we just see that people have been struggling for 2 and 3 years and they don't have a proper workup done. Of 60,000 users, only 2,600 have had any lab work done.
Wow.
Isn't that nuts?
That's
nuts, right? It's nuts. Yeah, It's nuts. So we want to change that. We want to try to make this more accessible so you know what to ask, so that you can turn to us. You can turn to Dr. Raquel. You can request a consult directly from her on her website, the Fertility Advantage. You can ask her questions through the app. I understand, the stress of it all. So, these are really important things to discuss. And, thanks. Oh, Serena just hopped back on. Thanks, Dr. Chen. We love you. And thanks, Fertility Gifts. I totally understand the stress. Dr. Raquel does a lot with stress reduction as well. So, she actually, because of an episode we did on the impact of melatonin on cortisol levels in the morning, because right in the beginning of quarantine, everybody was so stressed out. And so because of her and this show that we do, I started taking melatonin at night, and so did my son. And so we wake up in a happier mood because, we don't have that spike. Yeah, we don't have that spike. So this is great. I'm waving to everybody. It's so fun to see everybody on here. Yeah, right. It happened on the wrong day to get, and so it was inaccurate results. It happens where you weren't day 2 or day 3. It does happen, which is super frustrating. Yeah. All right, let's see. Mine is coming in large amounts, but down to stress. I mean, it might, or it might not. I mean, if you have, really heavy periods, yes, it might be stress, but it could also be fibroids.
Yeah.
Right?
Yeah.
It could be other things too. So, and yes,
that workup.
Harja, we will. Yeah, we will definitely get in touch. And, just don't forget, you can register on the app and, and ask questions as well, everybody. So, it's free. I mean, that's why we do this, because we believe that, so sweet. It feels like therapy. That's what we want. The thing about the app is that we believe 100% you have the right to personalized education, information, and healthcare, and that it should not cost you just to have personalized education and information. That's why we do what we do, and we will keep the app free forever. This is a question more for an IVF doctor, which I know Dr. Raquel will answer that way, but it's thoughts on an ERA after a failed frozen embryo transfer. So actually that came up with Dr. Chen and I yesterday's conversation, where it's actually indicated after 2 failed frozen embryo transfers. It's clinically indicated after 2, not 1. And so we just did an episode on that yesterday. So check our IGTV account. That was under Dr. Serena Chen's handle and Fertility Answers, but we did cover that a little bit, and we're happy to go in deeper for you. So stay tuned, and we'll add that into an episode on, as well. And thank you to Ayaforake. Hopefully I said that right. It's hard to pronounce everybody's handle sometimes, but yes, and we're trying to bring more providers to readily help patients. So we have, at this point, we have about 367, I think, board certified experts on the app answering questions. So yes, we do have, quite a few who will answer your questions. We try to route them by state so that if you do need to build a relationship with a fertility doctor, hopefully if you ask questions or do searching, you can kind of see the content in your state to make it a little bit easier on finding the right, the right person for you. Oh, that's so sweet. Hannah, thank you. She's learned so much in the last 5 to 10 minutes than in the past 3 years suffering with infertility. Oh, I have chills. I mean, hi to the UK. I mean, we, that's why we do what we do. Because, if even it just helps us set you up to ask the right questions when you get to that doctor, then we've kind of done our job. But Dr. Raquel has tons and tons of content out there on our YouTube channel, Fertility Answers, and she puts out tons of content on her Instagram account. So follow her at the Fertility Advantage. Awesome. All right, good. All right, I'm going to try to wrap up, but there's so many kind people. I don't want to get off. All right. Yes, we do this every Monday, every Tuesday, and then we typically put one in, do another episode on Wednesdays and Thursdays as well with a different, what we call key opinion leaders. These are board certified professionals. We cover topics like legal, health, naturopathy, nutrition. We've done a ton of things on nutrition, etc. So we will wrap this up. Thanks everybody for joining. Find us on the app as well. We also have free fertility navigators for you to just talk through your options. They're specially trained. Our senior navigator has 34 years of fertility experience. There's nothing probably that we haven't heard. Love you all so much. Dr. Raquel, thank you. And we'll see you next Tuesday for Fertility Tip Tuesday. Bye everybody.
Bye.